I'm Griffin Biedron. I'm a third-year medical student at the University of Vermont, and we're going to be reviewing initial concussion assessments today. As most of us know, maybe some of us don't, I'm going to kind of review a definition of concussions and we'll go from there. The concussion is basically it's a disturbance in brain function caused by either a direct or indirect force applied to the head. So essentially you're going to have a direct force applied right to the cranium, or maybe even have an indirect force applied, such as you could be in a car accident. As long as the brain is moving within the skull, you could have injury to the brain. So that's essentially what a concussion is. You have impairment of neurological function that will resolve spontaneously, functional disturbance rather than a structural disturbance. And standard structural neuroimaging studies won't be seen. You won't see any abnormality on a standard neuroimage. So those are some of the things to keep in mind regarding concussions. So essentially what I'm trying to do here today is simplify the initial on-the-field concussion assessment. So a lot of times healthcare providers that might not have a lot of experience in diagnosing concussions, we're trying to simplify it. We've reviewed the latest research, the latest techniques, and trying to kind of piece it all together to make it more manageable as far as making the diagnosis on the field. So this is a very concise, tight presentation of how to diagnose a concussion, on the spot as best you can using the latest research. All right, so I kind of have an algorithm here. You're on the sideline. You expect possible concussion injury, and we're going to run through this algorithm. You have an athlete that potentially has a concussion. All right, so our athlete's on the field. You can just take a seat. The first thing you're going to do is, we've all learned this, the ABCs. So you're going to be checking the airway, the athlete's breathing, and then he has circulation. Obviously, you're going to be checking, the pulse. Hopefully, if he's breathing, he's going to have the circulation. So the next thing you're going to do is, all right, if the ABCs are good, you're going to move on and look for cervical injuries. Obviously, if the ABCs aren't good, you're going to work to stabilize the patient. But all right, the ABCs are good to go. You're going to move on to check to see if he has possible cervical injury. So basically, you want to do this without moving the head or neck. You're going to assess the peripheral strength, sensation of the arms. You want to check the neck strength using isometric contractions. So you could say, for example, push against my hand, and he's not going to move his neck at all, but you're going to see if the muscles are functioning. And then you're going to also use possibly the Sperling test, which is going to test for nerve root compression. So if he doesn't have a cervical injury, you're going to move on to should we neuroimage this guy. If he does have the cervical injury, you're going to secure the neck with a cervical collar, transport to the hospital. All right, so out of your hands at that point. All right, so for neuroimaging, this comes with time, but according to the American College of Emergency Physicians, using their guidelines, if a patient has a loss of consciousness or amnesia and has one of the following, you're going to try and neuroimage. So, a diffuse headache, vomiting, if the patient's older than 60, intoxicated, deficits in short-term memory, trauma above the clavicle, so that's going to be above the clavicle right here, seizures, or if they're known to have a bleeding disorder, you want to neuroimage. If the patient does not have a loss of consciousness or amnesia, if one of the following is present, you're gonna neuroimage. So, focal neurological deficit, vomiting, severe headache, older than 65, a known bleeding disorder, or a significant mechanism of injury such as a vehicle accident or struck by a vehicle. These are indications to neuroimage. So if you're going to neuroimage, there's potential for severe neuroinjury, hospital transfer out of your hands at that point. All right, so that's for neuroimaging, hospital transport. At that point, if you decide not to neuroimage, you're going to do a quick neuro exam, kind of a clinical pearl. The way that I like to do it is you're checking for cranial nerve intaction. You want to make sure all the cranial nerves are intact. It's hard to check all of them, but with this simple test, you can check 7 out of 12, which is pretty good. And you can do this test in about a minute. So 7 out of 12 cranial nerves is pretty good. So what we're going to check here is basically you're going to check for cranial nerve 3 on this one and 4 and 6 with this test. So you're going to have the patient take a look at this finger. Just follow, you're going to keep your head still and just follow your eyes. Follow my finger with your eyes as best you can. At this point you're looking for nystagmus. Bring it back. Alright, and he's moving his eyes well, they're in sync. Convergence. Alright, so that looks good. That's cranial nerves 3, 4, and 6. That look good there. So that's ocular, motor, trochlear, and abducens nerves are good. Alright, so for this next test, real simple test, as you can see up here, have the patient say pa, ka, and ta. So could you please repeat pa, ka, ta?
Pa, ka, ta.
Alright, excellent. So the pa, that's facial nerve, cranial nerve 7. The ka is cranial nerves 9 and 10. That's the glossopharyngeal and the vagus. And then the ta is 9, 10, and 12. So you're going to add the glossopharyngeal, actually, the hypoglossal, my bad, for cranial nerve 12. So that's 7 out of 12 cranial nerves you've got checked off, just to make sure, brainstem lesion, try to rule that out as quickly as possible. At this point, you can have the athlete, we'll leave him seated here for time, but you can possibly move the athlete off the field at this point, if they're able to mobilize and move on to the next set of diagnostic criteria. And at this point, there's a couple ways to do this. There's 2 ways we like to do it. There's a couple of sideline assessment tools. One's called the SCAT-2 that I really like using, the Sport Concussion Assessment Tool 2. And you can see right here. And you can print out the form online and just Google SCAT-2, and it's distributed to the public for free of charge. And you can print it out and use this, or you can actually download an app if you're for the more technical savvy practitioner. And it scores it for you on your phone, on your smartphone, so that's another option. The other option is impacttest.com. You can order these cards that are really good at for sideline assessing, and we'll kind of walk you through these as well. So those are the 2 that we tend to use. So they're on the sideline. You've already ruled out number 1. You've ruled out a severe neuro injury, and we're going to move on to step number 2, the symptom checklist. And again, it's best to have familiarity with the athlete before giving this portion of the assessment. This is an important aspect of the assessment. Will give us kind of a bird's eye view of our patient's clinical situation. And so, for example, on the SCAT-2, there's kind of a list, 22 questions. You just want to get a feel. Actually, you can have them fill it out. They can fill it out on the phone. They can click, the buttons on the phone, or they can fill it out on this form. And you're going to say, none, mild, moderate, severe headache, pressure in the head,
None.
neck pain.
None.
These types of questions. There's 22 of them. That's how you're going to evaluate the symptom checklist. All right, and then as far as the impact card, as far as it's a sideline tool, they go through a series of questions as well, and that's another way you can do it using this sideline tool from Impact. All right, so after that, you're going to do cognitive testing, where you're going to be testing memory, concentration, delayed recall. Again, my favorite option on this is the SCAT-2 cognitive assessment tool. It's very reliable. It's user-friendly. It allows instant quantification of the test results. And it actually, on the SCAT-2, it uses the Glasgow-Coma scale, the Maddox questions, which test concentration and memory tasks. And there's a standardized assessment of concussions, which is kind of applied memory and delayed recall. You can also use, I'll walk through a couple of those right now. So essentially, page 2 of the SCAT-2 is where you get the cognitive testing. And once you print this out, it's very self-explanatory, and it makes a lot of sense, very easy to use. So, for example, the Glasgow-Coma scale, that's one of the items they use. I would ask, basically you're observing for an eye response. Is there eye-opening in response to pain, eye-opening to speech, or spontaneous eye-opening? Then it goes through a couple of verbal questions and a couple of motor responses. Does he obey commands? Is the pain localized? And it gives you a score which you can use in assessing the athlete. The sideline assessment, the MATIC score for concentration. For example, I would say to the athlete, I'm going to ask you a few questions. Please listen carefully and give your best effort. And the athlete, is on the sideline. So I would say, what venue are we at today?
Sports arena.
All right. And which half is it now?
Second half.
All right. So based on if they answer these questions correctly or incorrectly, they get a score out of 5. Cognitive assessment, I would ask him questions. What month is it?
April.
Okay. What is the date today?
The 26th.
All right, so you got that one right as well. So, concentration, seeing if the patient or if the athlete is able to concentrate. And then for the standardized assessment of concussion, which is testing cognitive assessment, there's a couple of questions that kind of runs you through here. For example, I'm going to test your memory. I'm going to read you a list of words, and when I'm done, repeat back as many words as you can remember in any order. So, for essential, I would say candle, baby, finger, paper, monkey, penny, sugar, perfume, blanket, sandwich, sunset, lemon, wagon. Alright, and then you would...
Candle, baby, finger, sunset, monkey, wagon, lemon.
That's pretty good. So obviously, if you're a concussed athlete, that's going to be a challenging test, and you got like 7 out of 15. So that's pretty good for someone who's not concussed. So if you're concussed, maybe 3-4 words, maybe pretty much all you can produce. So that's a good memory test. Now you can also use the impact sideline assessment tool for this portion of the exam, the cognitive testing. Similar questions. I'd ask the athlete following question: what stadium is this? You ask the athlete to repeat the following words, and there's a list. You ask what happened, what team did you play last week? Concentration. Repeat the days of the week backwards, starting with today.
Thursday, Wednesday, Tuesday, Monday, Sunday, Saturday, Friday.
Excellent. And then, so that would kind of see how well they're concentrating. So that's the cognitive testing. Takes a little bit more time, but very, very important to use when assessing where an athlete's at as far as their baseline. And again, if you have their baseline scores using the SCAT-2 or the impact testing card, that's helpful. But we'll talk more about this later because there's actually step 5, which I'm kind of jumping ahead to. We'll review this in a minute, but the neuropsychological test is one of those. It's one of those tests that gives a more accurate assessment of recovery, but we'll go to that in a minute. The next series of tests, the postural stability testing, where you'll ask the athlete to stand up, and essentially what's going to happen here is there's three trials. Essentially, they're going to stand, feet apart, their hands on their hips, and you're going to ask them to close their eyes and try to remain in this position as long as possible for 20 seconds. All right, close your eyes. So you're looking if there's any deviation from this position, foot coming out or an arm going out. Okay, so he's unstable there. That's an error. All right, so that's pretty good. So that's 20 seconds. So he had one error, and you record that on the score sheet on the SCAT-2. And then for the second test, based on the SCAT-2. Essentially, we're going to do a similar thing. So you're going to ask the patient, what's your dominant foot?
Left foot.
Okay, so you're going to ask the patient to stand on his non-dominant foot. On his right foot, he's going to bring up the leg to a 30-degree angle. And again, count the number of errors. It's 20 seconds. You're going to close your eyes for 20 seconds here. Count the number of errors. Alright, so he deviated away from midline, so that's an error. It's best to have the athlete begin to have their hands on their hips. That's actually better. Exactly. It's a little more challenging. Oh, that's an error. Put his foot down. Alright, so that's 20 seconds. So 2 errors for that. You'd record that on the SCAT-2. And then the third test, you're going to have the patient. They're going to put their non-dominant